Greetings, healthcare executives and clinical leadership. I appreciate the few minutes you're going to take out of your day to watch this video. I know you're all very committed to the well-being of your clinical staff. So why were you asked to listen to this voice recognition technology sales pitch from a cardiologist? Your organization may have had Dragon Medical One or Fluency Direct for years. You're a forward-thinking health system and value your clinicians' time. What am I going to ask you to do that you are not already doing? What if I tell you that your organization is surely underutilizing your voice recognition application and in the process, shelling out significant funds for years with minimal positive impact on system-wide efficiency? I can personally attest to the fact that voice recognition tools are indisputably the most effective and inexpensive tools to streamline documentation. The caveat is that for this tool to make a dent in clinician efficiency, it must absolutely be well implemented and adopted by clinicians. If you don't set your clinicians up for success, they will not adopt and continue to be tethered to their keyboards. Your organization will keep flushing its hard-earned cash down the drain with little to show for it.
Mrs. Janet Jones is an 80-year-old female with hypertension, multiple sclerosis, thrombotic thrombocytopenic purpura, open parentheses, TTP, close parentheses, status post-plasma exchange and splenectomy, obesity, osteoarthritis with bilateral hips, status post-bilateral total arthroplasty, coronary disease, status post-CABG in 2008, she had edema to LAD, SVG to left circumflex, SVG to RCA, period. She had a cerebrovascular accident on 3/26/2024, she was found to have multiple cerebellar infarcts on MRI, period. She initially presented to the emergency room with dystiadicokinesis, period. She was found to be in atrial fibrillation and is now on Xarelto for anticoagulation, period. She presents to our practice for follow-up of hypertension and CVA, period. Moderately controlled. 164/92. New paragraph. Insert denies. New paragraph.
During my tenure as ambulatory CMIO at Temple, we developed and fine-tuned a Dragon Medical One adoption and Epic EMR optimization program. This included very effective clinician engagement strategies, internal marketing, one-to-one self-scheduled training sessions, and hardware optimization, all resulting in resetting the trajectory of our Dragon implementation and propelling Temple towards organization-wide adoption. We expanded our user base from 168 users to over 800 very proficient users, many leveraging advanced Dragon functionality. This reduced documentation time for clinicians by 40,000 hours annually. Our team effort yielded an extremely positive impact on our 2022 AMA Clinician Wellness Survey, drastically reducing the time clinicians spend documenting after hours. Our reduction in after-hours documentation was in stark contrast to the majority of our peers, who are trending upward. We have shared our experience with our peers through presentations at Epic UGM, Becker's Healthcare IT, and our colleagues at the MGMA. Our team has also provided guidance to many small and large healthcare systems on how to establish a similar voice recognition and EMR optimization program to reproduce our quantifiable results. Because of the overwhelming success we had with our initiative at Temple, I decided that I wanted to replicate the same results at other healthcare facilities, and subsequently founded Medicascribe. I am deeply passionate about helping my colleagues reclaim their time, since I share their struggle as a busy clinical cardiologist, and I could not imagine seeing patients without my voice-enabled workflow. I truly practice what I preach. I am asking you to please take a step back and allow us to reassess your implementation of voice recognition. We will take on all the heavy lifting needed to identify your unique challenges and propel your adoption skyward. We will transform your clinician's relationship with your EMR and cement your position as a consummate clinician advocate. Streamlining your documentation workflow will help you diverge from the pervasive industry trend of rising clinician burnout. Let's get to the data behind this discussion. I'll quickly describe the resource recovery process and how it impacts your bottom line. Many organizations are already licensing a voice recognition application, and for those who aren't, you may now have a chance to follow a smoother path to an exceptional implementation. Now for some basic number crunching. Let's say you have 1,200 clinicians across your organization, physicians, NPs, PAs, residents, fellows, and you have a site license for your voice recognition application that is theoretically costing you $200,000 annually, and only 200 of your clinicians are splitting this fixed annual cost. Your per user cost is $1,000 annually per user, or about $83 per month per user. Doesn't seem awful, right? However, when you engage Medicascribe to drive your adoption and we grow your user base to 800 users, your per user cost has now shrunk to $250 annually per user or $21 per month per user, a 75% reduction in per user cost. You will continue to have a fixed cost of $200,000 annually, yet multiply the organization's voice recognition user base by 4x, an outstanding achievement. This should clearly illustrate that settling for 20 to 50% adoption rate should be unacceptable. Our goal will be to get you to a minimum of 80 to 90% adoption by ensuring optimal desktop configuration and application performance, engaging clinicians, internal marketing, and simplified access to training. So why is clinician adoption across healthcare organizations so low? Clinicians absolutely require training to effectively use voice recognition technology. The need for training goes unrecognized and resources are rarely allocated. The training strategy for voice recognition often culminates with, the clinicians are just talking into the microphone, right? They know how to talk. I'll just show them how to start recording. Sadly, this is far from the truth. Each clinician requires at least 30 to 60 minutes of training to initially alleviate resistance, to set application performance expectations, which we set at a very high standard, to understand basic and advanced functionality, as well as basic troubleshooting to get themselves through simple technical glitches and not give up. And most importantly, how to apply what they learned into their daily EMR workflow. Then and only then will they hit the ground running. Another common challenge is that many organizations are unfortunately understaffed from the clinical IT perspective, having only enough resources to put out 5-alarm fires, let alone search for unrecognized technology deficiencies. Medicascribe can play a critical role in filling these gaps with affordable turnkey solutions to boost adoption and offload overextended clinical IT staff. We will partner with your clinical IT team to ensure that we cultivate their expertise in applying our training strategies. We will build a functional and easily accessed one-to-one self-scheduled training tool for your clinicians. This service can be provided by our team or your existing clinical trainers who we will train. After establishing the foundation for success, we will continuously provide refreshed marketing tools to maintain downstream clinician engagement. Bottom line, why be happy with 100 or 200 users when you can have 800, 1,000, or your entire clinician base leveraging the tools you are already paying for? It's time to cut the losses and maximize your adoption. In terms of durability of our efforts, once we engage your clinicians and accelerate adoption across the organization, you will realize a sea change in culture. Utilization behests utilization. It becomes a self-perpetuating cycle of voice recognition adoption across the organization that will grow with your health system. In addition to improving your organization's dollar spent to user ratio of voice recognition, you must consider the trailing benefits. The increase in clinician well-being, time savings, decreased attrition, timely and compliant documentation resulting in shortened revenue cycle timelines. Consider the nominal cost of jumpstarting adoption an enhancement to your current investment, not an extraneous expense. It will prove to be a pivotal contribution to your clinicians' resources with perpetual returns. We understand that economics are critical to your decisions. You may never be presented a clearer decision than this one. With robust, quantifiable results, the numbers work. Engage Medicascribe to reduce your ongoing per-user cost of voice recognition and realize the valuable trailing benefits that come hand in hand. It just makes sense. Thank you.